Most plastic surgeons universally agree that rhinoplasty is the hardest operation. In rhinoplasty, it's important to achieve two things: symmetry and size proportions that are within a reasonable standard of normal. When you do that, and you apply the philosophy of small changes making big changes, you tend to get very natural outcomes. Rhinoplasty comes in all shapes and sizes. In our office, we have some categories. We have a polished rhinoplasty, which is a very minimal rhinoplasty, where all you're doing is straightening out a nose and maybe smoothing out some areas of contour irregularity. So that's a pretty minor surgery in terms of the degree of change you're looking for. Then we have profileplasty, where you're taking down the bump. We have tipplasty, where you're changing the lower part of the nose, the tip. And then there are some patients who only want an alarplasty, which is a alar base reduction or nostril reduction. And some patients want all four of those things. So it comes in all shapes and sizes. And then there's closed rhinoplasty, where all the incisions are inside the nostril. And then there's an open rhinoplasty, where there's an incision right across the bottom of the nostril here. And I'm not dogmatic, so if I start out with a closed and I feel that converting it to an open would benefit the outcome, I do that. You need to be a little dynamic, because the things you thought you were going to do before you started the operation may not be the things that you wind up needing to do while you're doing it. Many patients come in and they're concerned about scarring after their rhinoplasty. With a closed rhinoplasty, there are no incisions on the outside, so there is no real concern for scarring. When you do a nostril reduction or you do an open rhinoplasty, it's possible that those scars may be visible, but I have not personally had issues in that regard. In choosing a surgeon for your rhinoplasty, I think it's important for there to be three things. You need to have good communication. You have to like their aesthetic. Make sure that you like their before and after results. And also, make sure that they have a lot of experience in doing that operation. Of all the operations, rhinoplasty is the most unique and is never the same in one patient to the next. So it's very rewarding to get great outcomes and have happy patients, and it's one of the most rewarding things that I do.